Hi Kelly, I'm Dr. Keller, and today we're going to do Smart Lipo. What I wanted to do was go over some things with you, what it can do and can't do, what some of the risks are, and just give you some good information about it, okay? So, as you know, what we do is we take a laser and we put it under your skin, and it basically melts the fat, and then we extract it. It's different from liposuction in that we don't use a general anesthesia, so I don't put you to sleep. We use something called tumescence. And tumescence has changed the landscape of cosmetic medicine, okay? And we can be thankful to Dr. Klein for giving us that solution. So basically what we're trying to do is, if this is your skin and this is your muscle, we're trying to get the two as close together as we can. What's in the way?
Fat.
Fat, exactly. So we're going to remove the fat. And now the skin and the muscle can come close together, okay? So how do we do that? Well, the first thing we do is we put tumescence in you. And this tumescence is normal saline, bicarb, adrenaline, and xylocaine. So what it does is it's a local anesthesia, and it goes under the skin and it numbs up the specific area that we're going to treat. And today we're treating your inner thighs, correct?
Yes.
Okay. Now, you will be awake during the procedure, but you'll be a little bit in the twilight zone, okay? We'll be giving you, as you know, Ativan, we're going to give you some Phenergan, and we're also going to give you some Vicodin. That's been a pretty good combination. I've been doing, medicine for about 41 years, and I think we finally found a nice combination that allows you to be awake. It is protective of your reflexes, so we don't have to worry about you regurgitating or vomiting or not being able to use what we call the protective reflexes. You'll be awake and you'll be talking to me. Now, about half of my patients remember the procedure and half don't, okay? But you'll be conversing with me, and I'll ask you to stand up and move around, and that's very important because in liposuction, and this is not liposuction, in liposuction we put you to sleep, and it's very hard from an artistic standpoint to know, did we get this right? Because laying down is basically not physiologic. Using the tumescence, I can stand you up, turn you around, and then I can have you look at it too, because your perspective is different than mine. So you'll find that as we near the end of this procedure, I'll say, Kelly, stand up, and let's take a look and see what you say. And you'll say, Dr. Keller, now that I stand up, I see there's a little bit more as I look down here. And I'll say, Kelly, I think there's a little bit more right here. And so that's the fine carpentry work that we're going to do, okay?
Okay.
So that's good. Now listen. There's three things you won't like, so let's get it out of the way, okay? The first thing is I'm going to spray cold cleaning solution on you, okay? And it's cold, okay? That's number one. That's to kill the germs. Number two is I'm going to take a little needle and I'm going to poke it between the skin and the muscle in what's called the subcutaneous fat. Through that needle, you'll see that we have an IV bag hanging that has the tumescence in it. And through that IV bag, the third thing that you probably won't like is I'm going to use a squirt gun, kind of like, and it's going to go and it's going to spray that tumescence under your skin. What does it feel like? It feels weird. And if I say to you, Kelly, how does it feel? You go, oh, it feels weird. It feels like water going on your skin, okay? It shouldn't hurt, but remember, you're in control. So if at any time I cause you discomfort, blame my assistant. No, I'm joking. Just tell me and I'll stop.
Okay.
And then the tumescence numbs things up and we can go further, okay? Now, every once in a while, there will be an adhesion between the skin and the muscle. And as we spread that skin apart, it may sting a little bit, okay? And I never know who has adhesions and who doesn't, okay? But if you feel a little popping sensation, let me know. We stop. The tumescence and the Novocaine take effect, xylocaine, and then we can proceed. All right?
Okay.
Fair enough?
Yes.
Okay, good. So let's talk a little bit more about the procedure itself. So what we do is this laser that I use, okay, basically does a number of things. It does three really good things. The first thing is it cauterizes the blood vessels so that the bruising is minimum.
Okay.
The second thing it does is it also helps to melt the fat. So the fat becomes melted and it's much easier to extract, and that's why we can use a micro cannula. In liposuction, we use big diameter cannulas. This one, we're going to use one that's only about 3 to 4 millimeters in diameter, very small. It's called micro aspiration. Okay, again, very different than liposuction. Okay, so not only does it cauterize the blood vessels, minimize bruising, not only does it help melt the fat, but the thing I think that differentiates lipolysis using a laser to melt the fat is that the laser actually tightens the skin. So this process will normally occur, but it's speeded up with the fact that we're going to stimulate the cells that produce collagen to shrink it. Now, you'll find that over the next 1 year, we'll be seeing what this thing is going to finally evolve. And it's going to take about a year, okay? Why is that? Well, over the next several months, as the skin is coming together against the muscle, okay, it doesn't do it like a vice. It doesn't do it evenly. It kind of does it kittywampus. Why is that? Because the results depend on 3 things. It depends on my skill as an artist and a surgeon, and the other 2 things are up to you. And what do I mean by that? Well, if we look at this skin, underneath the skin, there are a number of cells, and I kind of look at them like they're throwing little gaffling hooks over to the muscle and pulling itself in, okay? So what genetically is important is how many of these cells do you have that are throwing gaffling hooks, okay? Because that'll determine not only how fast, but how evenly. So for example, if you have a clump up here and a clump down here, then it's going to not do it like a vice. It's going to do it kind of uneven, okay? Mm-hmm. And the third thing that depends on the results is your motivation. Because look, once we get rid of this fat, the next thing we want to work on is the muscle. Because if the muscle becomes large and well defined, it'll show through the skin better. Does that make sense?
Yes.
Good. Okay. So over the next several months, as this is happening, and there's no way to know that until we're actually in the healing process, okay, you may get the lumpy bumpies. What's that? Well, you'll feel and go, it feels kind of lumpy. Yeah, it feels lumpy because some of that debris, even though I'm going to suck out a lot of the fat, there will still be debris in there. And that debris, okay, is what gets trapped. Because ordinarily, debris is removed from our bodies through the lymphatic system, right? The lymphatic system is going to be disrupted as we do this process. And it takes about 6 weeks for it to reconnect. In the meantime, we've got this happening, and you can get things walled off. And so they're kind of isolated, and it takes a while for your body to get rid of it, okay?
Okay.
So after a year, we reevaluate this. And if there's something like, almost like a little lipoma, we call it, it feels kind of like there's a lump there that just won't go away, then we just take our laser, we put a little local anesthetic in there, and I just go in with my laser, and it goes zzz, and we melt it, okay? Chance of that, probably won't have to do that, but I mentioned that. Okay. What else? Well, how do I get the laser in there and the microcannula? I have to make little holes, okay? So I'm going to minimize those holes, and I'm going to try and put them where they won't show a lot, okay? But please, don't tie my hands from an artistic standpoint by saying only put 2 holes in. I will put the minimum number in, okay? And we put the holes in for 2 reasons. One is to drain the fluid back out, but the other is to actually aspirate the melted fat out, okay? Mm-hmm. Let's talk about these holes. What can happen? Well, they can be dark, okay? They can be a permanent invisible scar. Now, what do I mean by that? Well, when we cut, and they're very small, they're only about 2 millimeters, and they're just a little nick, okay? But remember, I'm taking my laser and my cannula, and I'm going back and forth, and I'm bruising the edges of the skin. So when they heal over the next several months, it's bruised tissue next to bruised tissue. And when tissue, your skin, is bruised, it tends to pigment, okay? So let's say after a year, we don't like the way that looks. What I do is I put a little Novocaine in there, okay? And I use a little punch, like a cookie punch, and we just remove that bruised area, that pigmented area, and I put one stitch in, and now we've got healthy tissue next to healthy tissue, and the scar is much more minimized at that. About 95% of the people that I deal with don't really have that problem, and they don't even notice it after a while. And there again, it depends on how you heal. So you don't have keloids or anything like that, do you? Okay, and it looks like you heal pretty good, huh?
Yes.
Okay, so that's something to think of. Now, what could go wrong? Well, let's talk about that, okay? First of all, is it possible to get an infection? Yes, it is, because anytime you break the skin, you can get bacteria in there. That's why you want a prophylactic antibiotic. It's very rare to get an infection. Why? Because the fluid is draining out, so the bacteria has to swim upstream, okay? And it's constantly draining out. The xylocaine that I'm putting in there and the tumescence kills bacteria, okay? And the laser is killing the bacteria as well. And you're on an antibiotic, okay? So we're going to watch carefully for an infection. We're not going to expect one, but we're going to just be observant for one. Red, hot, angry looking, okay? Call me 24/7, all right? And say, hey doc, you know, I don't know, so come in and see me, or if you're not where you can come right in, take a picture and send it to me and we'll talk on the phone, okay? What else? Well, we're using a laser, so is it possible to get a burn? Yeah, it's possible to get a burn. Now, that usually happens when the physician is not paying attention, and I'm constantly reminding my students, keep your hand moving, and when your hand stops, your mouth stops, and the laser goes off, okay? Because if you leave the laser in one spot too long, it'll heat up the skin and burn it. What do we do to prevent that? Well, you'll see that I'm constantly moving my hands while the laser is on. But you'll also see that my assistant has a thermal gun, a laser gun, that will tell the temperature of the skin. And so she'll be calling out a lot of numbers, okay? And there's a particular temperature we don't want it to go above, and as long as we stay below that, we won't get a burn, okay? What else? Well, we talked about the lumpy bumpies, okay? Talked about infection. Is it possible to get uneven results because things are not coming together in the same fashion? Yes, but again, we can fix that, okay? So that's possible. Is it possible to have those scars be permanent? We talked about that. Yes, it is. So let's go over some of the other complications, and I'll just read it off your consent form, okay? So here's what I put on here, okay? And again, these are very rare. Can you get bleeding? Yeah, because we're breaking the skin. And bruising, yeah, but again, it's minimized by the adrenaline. And the adrenaline, by the way, that we're putting in there causes the blood vessels to constrict. So if we happen to hit a blood vessel, it won't bleed much, okay? And infection we talked about, scarring we talked about, skin contour irregularities, asymmetry from that compression we talked about. Surgical shock. Now, what do we mean by surgical shock? This is kind of a general form of any time you're kind of under, surgical shock is your blood pressure can lower. That's why we'll be monitoring your blood pressure and your pulse ox and your cardiac rhythm during this time, okay? But here again, that mainly implies when you're under general anesthetic, okay? Pulmonary complications. Well, in the old days when we used to do liposuction, okay? Sometimes those big cannulas, and with you being asleep, you didn't have any what we call guarding response, so it was possible to perforate through the muscle down into the abdominal cavity, and that could cause a little embolus. We never go below the superficial fat layer, okay? And if I come close to your muscles, you'll guard. So it's darn near impossible it is impossible to go through that unless you really, do that. But this is a very tender and a very gentle procedure, okay? Skin loss, what they mean by that is if it gets burned or infected, the area could get necrosis, and that's where the blood vessels aren't viable and that little piece of skin could die, okay? Again, these are extremely rare complications. A seroma or hematoma is when the skin and the muscle are coming together. Sometimes blood can get trapped in there, called a hematoma. or sometimes a liquid part of blood can get trapped in there. And